So here's what we're going to do. I can. Good.
You have somebody funny.
That's good. Okay, good. So here's what we're going to do. We're going to go through how I set up Eaglesoft for both charting, and we're going to dig a little bit into my schedule too. So let's do this. And then if anybody has any questions, you can unmute yourself, ask a question, throw it out there, and then we'll go through that. But let me go through a couple of just the setup things first. First of all, you're going to notice that my computer looks nothing like your computer. It's my OCD. I've gone through and I've rearranged the operatory. I've changed the pictures. I've done all kinds of things, but it works all the same. And I'm using version 17 on my desktop. This is kind of my incubator. This is the one that I use as I do a lot of my testing. I have this computer with 17, I've got another computer with 18, and I've got another computer with 19, but this is kind of my daily driver, so you guys can, most of you guys can relate. So let's go through my setup here. So I'm going to go to File and Preferences, and I'm going to show you in my Chart tab how I have my system set up. So let's go to the Chart tab. And let me go through my colors because some people are going to be a little thrown off by the colors that I use, but there's a logic to it, and it's my logic, so it doesn't have to be everybody else's logic, but it's the way I do things. I use existing as gray, and I think about it like a ghost. It's there, it's fine. Or think about a battleship. It's there, it's fine, and we're all okay with it. It only becomes a problem when it becomes defective. So if you have an existing restoration that becomes defective, and when I say defective, so that's an amalgam that the amalgam is broken down, not new decay, or composite where the composite is breaking down. That's not new decay, that is a defective restoration. Or the margins have opened up on a crown. That could be a defective restoration, the porcelain's off of it or something, all right? If that was new decay, it would be a condition. Conditions are those things that happen naturally, let's call it that. So if there's an impacted wisdom tooth, if there's decay, if there is abfraction, those kind of things I consider my conditions. Those are orange, and I think about it like a cone that sits along the side of the road. The idea is it draws your eye to it on a regular basis, but if there is some solution to that, we're going to propose a service. Now, if that condition is no longer present, I use this sort of pale blue gray. And the only time I ever use this is a situation like an abscess. So you'd have this sort of circle at the bottom of a tooth, denoting an abscess, and that abscess is now resolved. I would mark that as condition no longer present. It would turn this sort of bluish gray, and it almost looks exactly how it looks on a radiograph. So that's about the only time I'm going to use condition no longer present. Now, I use green for my proposed. I don't use red. I used a red and blue pen when I was learning how to do this stuff, but I also used an abacus when I was in school, and I can't expect that everybody would use the same exact things that they used in school. So I don't use red, I use green. Green means money, green means go, red means stop to me, so it's my logic. You'll have to live with it. When it's completed, it's blue. It's not something that the clinical area has to think about because it turns blue when we charge it out, so that's the way it goes. Watch, I use the same color as I would use on a Post-it. And because I don't use that right-click watch that often, and I'll show you why, you'll never really see that in my chart, but it's there. I use brown for referred because it's crap I'm not going to do. Really easy way to remember it, all right? And black is for walkout because it's only that color when it changes from proposed to walkout. It's only going to be that color till the person gets to the front desk and we charge out that service and it turns blue. So I just want this dramatic change from green to black so that I can see that it's been walked out. And the last color I use is rejected because that means stop, don't do it, we're not going to get this done. So you'll see in one of my charts, when I use red, it tells me not that there's a problem, but that the person said to stop. So just so you guys know what my colors look like, I'm going to open up a chart. Go to my list of patients, pull up my first guy here. And I'm going to click on the chart. Now, one of the things that you'll notice about my system is I don't have, or I shouldn't say, I have very, 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 very few pop-ups. So you're not going to see pop-up alerts in my system because we're trained to ignore pop-ups. Pop-ups typically get clicked on because we just don't want to see them. So I have my alerts show here. So this patient, Charles Average, can't have epi. He has a hearing problem. All right. He is due for bite wings. He's due for a full series. He only wants to see Dr. B. He needs to be pre-medicated first. He has Blue Shield. All right. He has a private memo I should read. He is overdue for his recall, as I could tell this toothbrush. And he also is missing his medical history form. So that's the way I can tell without having pop-ups. So open up his chart. And my computer is lagging, I guess, with everybody logged into it. So bear with that too. So let me turn my imaging on here. So based on the colors that I told you, you should be able to tell what this patient has as a treatment plan, what they have as conditions, what they have as watches, what they have as defective services. So let me just go through this chart so you can see. I use a straight line to show referred extractions, because let me just, I'll propose to extract this tooth. So if I propose to extract this tooth and it's something I'm going to do in the office, it shows up as an X. If I were proposing that an oral surgeon were going to do this, so let's pull a complete bony, partial bony. If I propose that and refer it, see the difference? So now I can tell when the patient comes back and they've had a service done, and I go in to edit that service, and I can say that that is now an existing extraction. So now that's a gray straight line as opposed to something that was previously extracted. So let's delete this. So if this was an extraction that was done prior to the patient coming to see us, it would have an existing X as opposed to an existing straight line. So that's why I can tell this is an extraction that was sent out, it was completed, and now it's an existing extraction. That's an extraction the patient had before they showed up in my practice. So again, I need my chart to look like a billboard along the side of a road. And I say that because I want to be able to walk by this chart doing 90 miles an hour, which a lot of us do in our practices, and be able to read everything I need to know about this patient without having to stop and read. Most of the time, I turn my ledger off, so I don't have to even look down there. So I actually turn these two things off so I can quickly look at my chart, and I can tell almost everything about this patient. I know that I have notes attached to tooth number 4. I know I have images for tooth number 4. All right, so let's turn the images back on, and let's click on number 3, because I know that there's an implant that was referred out. Now, if the patient came back, we want to know what kind of implant that is. So attached to tooth number 3 is the photo of the implant bottle, a photo of the custom abutment label, all right, a letter from the specialist, a screenshot from the cone beam that was done. So I can quickly, imagine I'm setting up to insert this crown, and I need to know what kind of implant did we place there. Quickly open it up, and that is if it will do it, Brennemark 3.3. I can grab my wrenches, and I can be ready to insert this crown, because all the information is there. If there was something special that the referring doctor had written, I can open up the letter, read about the services that were done, and understand what was going on with that patient. All right. So again, quickly looking at my chart, I can tell what I need to know. This tooth was referred out for extraction. It was impacted. This is a all gold crown. That's a stainless steel crown. All right. This is a PFM to be done. That's a PFM. There's an existing composite or amalgam. I could click on it if I need to know for sure, but I'm patient in the chair, so I could probably tell. There's a little incisal restoration to be done. All right. That tooth needs a root canal because it has an existing abscess. That tooth had clinical crown lengthening. This is a retained primary with little snake eyes, probably amalgams. That is a watch on the mesial incisal, or sorry, mesial occlusal of that tooth. That's a crown that was defective when the patient presented with a post and core and a root canal. All right. That tooth, there's nothing wrong with. That tooth's impacted. So I can quickly tell on that upper arch exactly what's going on. Now, why is it that I have not proposed anything on that tooth? I'll show you why. If I look at my show what, and I add perio to it, so I don't need to see pockets and I don't need to see bleeding. All right. So do you see that big perio defect that's happening there? That's why I'm not touching that crown yet, because there's something going on from the periodontal standpoint that I've got to figure out what I'm going to do before I start treating that crown. So at the moment, I'm just going to leave it alone because maybe just the porcelain's off of it. So when you start layering information, you can see a whole lot more. So again, impacted wisdom tooth, PFM, some sort of restoration that we did at one point. There's a root tip, there's a missing tooth, there is a lingual bar. Now, really hard to tell, but if you look right there, if you can see those little lines around number 28, that lets me know that tooth's got some mobility issues. All right. There is a crown to be done. There is a stainless steel crown with a root canal. That's a virgin tooth, an impacted tooth. Now, one of the things that you'll notice is, do you see these blocks around my third molars? Now, I told you that blue in my office means completed. Somebody drew something there. I don't know if they're asking a question or not. But there's those blue blocks on that side let me know that that side of the mouth has been scaled. And the green blocks let me know that that side of the mouth needs to be scaled. So if I right-click, edit the service, and go to the scaling, if the person said, you know what, you did the left side of the mouth and it was just too traumatic for me, I'm never going to get the other side done, I can go and I can say the patient rejected those services, and now I'm going to show in red. I would do that with the bottom too. And now I can see we've completed that side and the patient said, stop, don't do that side. So the proposed service has been rejected. And that's how, like I said, I can look at my chart and quickly see what's going on across the board with every patient that I have. One of the tasks that I try to do when I teach charting with offices is to make them understand that there is absolutely no reason to leave this chart to get to any other piece of the software. So if you're in this chart and you need to go someplace else, like you want to even change to another patient, so you're looking at a husband, you want to look at the wife's charting, you can just go here, change your patient, pick another patient to go to. So let's go to this. Imagine dad saying, you know, how's my daughter doing with her ortho case? Let's go to the daughter and open up her chart. Now the screen's going to refresh. It's going to open up with the daughter's ortho chart. And all of the information about the daughter is going to show up. So she's due for bite wing, she's got delta, she's due for her checkup, and she's missing her medical history form. And here we're looking at her ortho chart. And I can see that she's still in banding and bracketing. This tooth needs to be orthodontically raised, band and looped. So I can see a lot about this patient by just switching those views. All right, let's pick another patient here. Let's go to Frank. Now, this is one of the things that Eaglesoft has a really tough time doing, is to show a denture over an implant. All right, and there's a trick to it. If you, and I'm just going to do 8 and 9 up here. Imagine we're proposing a full denture up at the top. If I go here and I say, okay, we're going to do implants. So I'm going to grab my implant button and I'm going to propose an implant. And then I propose the denture. So denture. I know I'm not using the right codes, but that you'll get an idea. Do you see how it hides the implants? So the alternative would be to change the sequence and to do the implants second. But if you do that, then you hide the denture. So what I've done is I've actually created a custom drawing that basically it shows the implant under the denture. So it kind of erases the bottom of this so that the implant shows through the denture. Now, that way I can tell where the implant locators are going to be and where the implant's going to, going to need to be adhered to. And you can see I've actually done a little custom drawing to show where there's actually a screw retained implant as opposed to a implant, an abutment retained implant. So let me do this. There's my attendance list. I'm going to unmute everybody and see. Does anybody have any questions so far?
Andre, this is Johnny.
Johnny.
Are you going to show us how you create these conditions?
Yes, I am.
Okay. All right.
Okay.
That's all I need to know.
Good. Anybody else?
And you said raise prices.
Okay. I'm going to mute everybody again. And let me show you how to do at least one of these. Now, a lot of these, and I'll show you, a lot of these custom drawings are very, very tedious, and I'm just going to say they're almost impossible to do. So let me just show you how you make a custom drawing. And this is going to be an easy one for you. So if I go to List, and I go to Draw Types, and you can see right here, I've created all these that say Custom. These are all custom drawings that I've done, and they're all pretty much done pixel by pixel. I mean, I've been doing this for a really long time. So, and I'll just show you this. Let's find the crown. So in order to do this drawing, where I just show the occlusal surface of a crown pixelated, I actually had to take this crown, zoom in on it, and take my eraser and get rid of every other pixel. I mean, that's how difficult this is. It's a little crazy, but that's the way you have to do it. So I'm going to show you how to do a couple of these that are really simple. So if you ever want to do the same idea, I mean, obviously you can do it really quickly. We're going to take your crown, and we're going to edit that crown. All right, and it's going to make a custom drawing based on this crown. All right, and this is what I'm going to do. I'm going to call this crown ceramic. All right, and I'm going to take my eraser tool, which is this one. I'm going to make it the smallest brush size, and all I'm going to do is stripe across the occlusal. Now, this won't be as pretty as the other ones that I did, but you get the general idea. And you have to do this 16 times because you're going to have one for every tooth in half of an arch, and then it will flip over to the other side. But you can see how quickly I can do this. And all I'm doing is just using my mouse to just drag across the occlusal of this tooth. But in the end, I'm going to have a custom drawing that I could use for, say, if you're doing Surat crowns or if you're doing something like that. It's a quick way to have a drawing. See, I've gotten to 8, so I've got half of the arch done. All right, and these are easy. So to do a custom drawing on a tooth, and obviously on a crown, you probably don't need to do the primary teeth. 29, 30. Okay, so I'm going to save that, and now it's in my list of crowns, as called crown ceramic. And now I'm going to go to List, Services, and let's find crown. I made this custom crown Surat code here, and over here it says Chart Setup. I'm going to choose that and change it from my crown pixelated to my crown ceramic. And let's put it on a patient. So let's take number 1. Our drop down for crowns, and we did crown Zurich. And see that stripe? So that's how you can create a custom draw type, add it to your system, and have a very specific drawing for a specific procedure, like the ones that you saw that I did here. The other ones are a little more difficult, but this, I mean, that's an easy, quick way to be able to tell your PFM from your all-ceram crowns. And some of these other things might not be important to the clinical team, but something like that might be very important. The example I always give is if you've got an Emax crown in there, and all of a sudden the tooth's got an abscess, that crown could take you 2.5 hours to cut off. So knowing an Emax crown versus an all-ceram crown, it can make a big difference. So those are the kind of things that you can do, and that, like you said, that took me, 30 seconds to do. There are a lot of other ones that you can do pretty quickly, like getting rid of the impacted distal, impacted mesial. If that's not important, if you're an oral surgeon, that might be important, but you could just take your impacted distal, edit that, create a custom draw type based on that, and just go through and erase the arrow. And now you just got to have a loop for your basic impactions. Get rid of two conditions, make it one condition, and make your list a whole lot shorter. No, I don't want to say that. Okay. So I'm going to unmute you for another sec. Unmute all. All right. Oh, geez. Any other questions while I have you unmuted?
So the condition with the SRP, when you had it, this is Johnny, by the way.
Yep.
And I asked 100 questions, but
that's okay.
So when you do that, that is a condition, and you just created that as an SRP, correct?
No. What I did was I actually took an existing drawing, and I'm gonna mute you until I explain it.
Okay.
Okay. So what I did is I actually went down here, and there is a bone graft drawing, which actually is terrible, because what it does is it creates this socket, which is not what happens when you do a bone graft. You're filling in the socket when you do a bone graft. So I repurpose this drawing. So I just rename it SRP. All right. And I leave it on my 3rd molars, and then I erase, so I clear every other tooth. So this is like the most simplistic one that you can do. Just clear all the other teeth. All right. And when you're done, I won't do the whole thing. I'll just show you the SRP that I have here. So I have a solid one, which is just on tooth number 1 and on tooth number 32. And it just says SRP solid. And I go up to my list, go to my service code, and go to my D4341, and under charting, there's my SRP drawing. So that's all you need to do in order to make that SRP drawing and connect it to your service code, and that way you can have that drawing show up for your SRP. Where'd it go? There it is. Does that make sense?
That's perfect.
Perfect. So, I mean, and like I said, some of these things are going to be important. Some of the things are going to be completely unimportant. But, for me to be able to see everything, which means I have, I don't have to go through a whole lot of audit trails, a whole lot of looking for things. Let's see. All right. So, and now this drawing tells me that this person has bone grafting. All right. That makes a whole lot more sense in my mind than that open, open socket. All right. Let's see, what time is it? All right, good. I'm going to unmute everybody. Anybody else have any other questions about that? No? All right, so let's try this. Let's go to our schedule. Because we had a lot of questions about the schedule and how this all worked together. So I want to show you a couple things about the way that I have my schedule set up. So, and I'm going to unmute you because you might have some questions as we go here. Okay, so here's my schedule. My colors are very, very simplistic, like you saw the colors that were in the charting. And what you're going to see is, you know, I can tell from my schedule, even if you don't look at the names. Let's do Control H to get rid of names. All right. So if I look at my schedule, I can tell for production, the darker the green, all right, the more money I'm going to make. All right. In my hygiene department, the darker the pink, the more I'm working on gums, and the darker the yellow, the more I'm working on teeth. So these are kids. All right. Those are adults, and the gold are my new page. The light pink is perio maintenance, and the dark pink is SRP. And I can quickly tell how my day is going to go without having to look through notes, look through anything else. I can tell exactly how it's going to go. Reds are going to be emergency, orange is going to be endo, blues are going to be dentures in my case. So I can quickly tell what's going to happen in a day just by looking at my schedule. Now, if you notice on these columns on the side, these margins, do you see the yellow? I don't know if anybody's ever paid attention to this before, but the yellow lets me know that the primary provider is either double booked, meaning yellow, or triple booked, being pink. So if I switch into my AP color, so I'm looking at my procedures now. If I go to my providers now, I can quickly see that this is Dr. Gray. He's blue, but he's doing that exam and that exam and that exam. He's doing that injection on that SRP patient, that exam there. And then my Dr. Beer, who's orange, is doing that injection and that exam, that exam. So I can quickly switch this on and off without having to do a whole lot of thought to find out where my doctors need to be and then go back to what procedures they're doing. All right. But I can also do this, turn this on and look down this column and quickly see, okay, well, here's a purple patient. That means that is Barbara's patient in Phyllis's column. So that's going to get walked out improperly. So that needs to be fixed and moved into Phyllis's column. So it's a two-parter. I use this AP button to make sure the patients are going to get walked out properly, but also to make sure that my doctors are not double booked.